ठीक है। अच्छा सर, इससे पहले ना जो जितना हमने सैंपल जा रहा है इसको उसका एक डमी वर्क बना के वॉल स्केचिंग सब कुछ और अभी है
आप आ जाओगे तो मेरे को जब आप हैंड ओवर कर दोगे तो जनता को डाल दूंगा फिर आप लोग डाल देंगे सबको नोट कर देता हूँ
Hi Arindam, congratulations.
Good afternoon, Rakesh ji.
Good afternoon.
Good afternoon, Bala.
Sanjay. Happy to be here.
So we are just waiting for more customers to come. So in a 2-3 minutes we'll start.
Okay.
Hey Ravi, now I think we have sufficient persons there. So you can start now.
So Sanjay, should we start? Welcome everyone. Sanjay.
Yeah.
Hello, Ravi. Sanjay.
Okay.
Yes, sir.
It's already one of the two policies. So it's already one is already removed. So there is no need of second one. Next policy.
Hello, Sanjay, can you hear me?
Yeah, we state again there are two policies. Okay. So one is already removed.
Welcome everyone.
Actually, by mistake, I meant for two policies. Okay, meant for two policies. So अभी ये बार में एक ही पॉलिसी में मुझे चाहिए, दो नहीं चाहिए.
I request participants to please mute their mic. So welcome everyone. Thank you for joining us for stain resistant, moisture resistant, odor resistant, antiviral or antimicrobial with unchanged breathability. Today we have team of Healthguard and Beta here to enlighten us about the features in the development of these fabrics. In addition, have our presenter.
We could have invented new ways of logistics management. The camaraderie amongst people, our friends, our neighbors is at a different level today. We have polished our IT skills. Today, for example, we are talking on a platform which some of us may have known, but many of us would not have used at all. For us at Vardhman, we are using it for the first time. Ultimately, all this knowledge that we gained in this time, all the fitness that we gained, if we talk at the industry level, today we are talking about digital presentations. We are talking of virtual factory tours. We would have never thought of such kind of technology usages is otherwise considered very traditional. Nevertheless, it requires a great support, great hands from all the stakeholders to sail through this time. In Vardhman, we really consider there are 4 basic pillars on which the modern philosophy of Vardhman is based. Hello, Ravi, there are some disturbances coming in. Can you mute them?
जी सर, बढ़िया सर, बताइए. वो वर्धमान जी मैं लगाता हूँ.
We're talking of 4 pillars on which Vardhman business philosophy is based. These are speed, flexibility, innovation, and sustainability. I just give an example, the speed and flexibility. All of us were under the lockdown since 22nd of March, and after a month or so, by end of April, we had certain orders which the customer wants still open, and the order was urgently required, and the order quantity was just 2% of the production capacity. So we were also in dilemma. One thing was clear, that we want to serve the customer, but how to serve the plant, how to handle the order, which is not worth even 1 day's production. But one resolution was clear, that we have to serve the customers. And starting from then, from less than 2% capacity utilization, today we have reached at about 50% capacity utilization. And I want to take this opportunity to thank all my customers, all our customers. Without their support, this would not have been possible. And the
specially designed rich light breathable construction for comfort. Made from rich 100% polyester and polyester blend. Antiviral and antibacterial properties keeps you safe from infections and germs. 99.94% effective against coronavirus. repellent performance helps to repel any moisture coming towards fabric surface.
Long-lasting effects.
Hello, I'm Dr. Christopher Harvey, the founder of the Healthguard Corporation. My company have been leading innovators in biotech health prevention for over a quarter of a century. We are producing some of the finest non-invasive health prevention chemicals on the market today. We are market leaders in asthma prevention, malaria prevention, and bed bug bites. I am proud to be associated with the research and lead a team of technologists who are second to none in this world.
Are you ready to take the success of your product to the next level? Join the Healthguard revolution and give your product a unique selling point thanks to a brand name and logo that is proven and trusted around the globe.
All right. Has the presentation come up on the screen? Is everybody able to see?
Yeah, Victoria, we can see.
Yes, we can see this.
Thank you very much. Well, we'll begin by introducing ourselves. As mentioned by Ravi before, to the left of me is Dr. Christopher Harvey, who is President and Founder of the Healthguard Corporation in Australia. No. And I'll introduce myself. I'm Victoria Harvey. I'm Operations Manager of Healthguard. We are very delighted for the opportunity to present to Vardhman team and clients. We come to present the world's best technology in non-invasive preventative healthcare. So just to give you a little bit of a background of our company. So we're a privately owned and operated research, development and manufacturing company for non-invasive healthcare. We have been in this industry for over 30 years and we make a wide range of solutions as presented on the video. We would like to introduce you to our technology today, focusing on 4 products known as Healthguard BK, Healthguard Amick, Healthguard PL and Healthguard PLB. Working through chronologically, this is a antimicrobial, antiviral, anti-mosquito and anti-dust mite solutions. We'll begin by introducing Healthguard BK. Healthguard BK is a specially formulated non-silver broad-range antimicrobial treatment, which was developed with the on the base of cosmetic-based chemistry. This product was strategically based with the cosmetic chemistry due to the safety of the product. It is proven to have high wash durability at ultra low dose. This technology is often used in conjunction and we highly recommend Britical silicons due to the sustainability of the product and to increase the wash fastness of the product. The features of Healthguard BK is that it's compatible with a broad range of textiles, from apparel textiles, advanced textiles, and technical textiles. It's ideal for application to mattress tickings, polyester fibers, quilts, and as mentioned before, it has a high wash durability at an ultra low dose. Just presenting testing results. As you can see, when used in conjunction with Britical's Ultrasil silicons, the wash durability is enhanced. You'll note that these type of results are repetitively achieved. On the left, we've got a 97.35%. In cooperation with the sustainability approach that Vardhman follows, this is certainly representative of that. Given the high wash durability, these type of products, due to a reduction in odor, will otherwise there'll be less times between which you have to wash it to maintain comfort. I'll move to the next slide. We now present to you Healthguard AMIC, which we otherwise refer to as Healthguard Amick, and incorporates the features of the Healthguard BK with the added addition of an antiviral property. Healthguard Amick has been.
तो मैं बस देख लेती हूँ. I will not sign it. तो मुझे दिखा दो.
Healthguard has been on the market for over 2 years.
मैं इसकी वजह से होल्ड करने की जरूरत नहीं है. You got fabric approval की fabric की क्वालिटी में कोई प्रॉब्लम नहीं है.
Can I
Sorry, I was just
mute?
Mute only.
Yes.
No problem at all. I'll continue. Healthguard Amick has antiviral features on top of those of the features represented on the Healthguard BK. It's achieved excellent wash durability with over 96% reduction of virus after 20 washes, and has excellent performance with antibacterial with over 99% after 20 washes. This chemistry has been thoughtfully formulated using a cosmetic-based and food-grade chemistry. The features of Healthguard Amick is that it's suitable for apparel, textile, advanced textiles and technical textiles. It has a broad range of applications, most certainly suitable to face masks. You'll note the classification in Europe specifically mentions these types of products that are suitable for healthcare.
Vardhman to be the first people to receive this information. I have the report here. I don't know if this is showable on the screen. Is that, can anybody see that? Yes or no? Okay. Anyway.
Yes, it is possible.
Okay. Thank you.
Thank you. I am going to go straight to the conclusion, as any scientist would do. We don't want to read all the rest of it in between. After 10 minutes exposure, the human SARS-CoV-2, which is COVID-19, well, on a 2% Healthguard Amick treated fabric, after 10 minutes, significant virucidal activity was exhibited. After 10 minutes, the virus was reduced by 99.99%. After 60 minutes, which was our second time for exposure, I can only tell you this is the most fantastic result anybody could ever wish for. Our Healthguard Amick totally destroyed the COVID-19 virus. It was not detectable. And after 120 minutes, again, not detectable. Healthguard Amick is the premier anti-COVID-19 fabric treatment in the world. It is totally destroying the COVID-19 virus. Thank you.
Thank you. So we're very excited to share that news with you. In that case, we'll continue on to show you some other results that we've achieved with Healthguard Amick. As you will see, on the 99.94% antiviral activity rate was achieved as per ISO 18184. On the right-hand side, the 99.20% was a percentage reduction of virus after 20 washes. This fantastic result was achieved in conjunction with using Laxoft 68, which is a microemulsion silicone, proudly presented by Britisal. As you'll notice, the wash fastness is very much enhanced in conjunction with Britisal Silicone's range of products. At the bottom, we've also got a 96.60% reduction in microorganism after 20 washes. This was achieved against Staphylococcus aureus, cane pneumonia. On the screen, we've got a visual demonstration of the way in which the Healthguard Amick works in comparison to that of an untreated fabric. You'll notice on the untreated fabric, the virus becomes intact between the fibre, between the warp and the weft, which otherwise carries on your clothing and disattaches upon coming in contact with other surfaces, which causes the spread of the virus. On the right-hand side, you'll notice the Healthguard treated Amick is rupturing the cell wall of the protein wall of the virus, which destroys the DNA. I'll allow Chris, seeing that he's the scientist here, I'll allow Chris to explain that a little more clearly.
Right. What we all need to understand is, why do we want clothing treated with Healthguard Amick? Clothing is a perfect carrier for virus. When a person sneezes or coughs, there is an aerosol of micro particles coming out of a person's nostrils or out of one's mouth. Now, if that aerosol of droplets is allowed to rest upon clothing, you can see on the illustration on the left quite clearly shows the virus particles resting there, and they will do so quite happily for many days. And I'm talking about many days. They will sit there hours and days, and they will still be alive. And should anybody touch them, your child, should one of your relatives, a friend, a passerby, anybody touch your garment with their skin or with their other clothing, these can be brushed off onto their clothing, and the disease is beginning to spread. Now, quite clearly on the right, we're not able to give a pictorial images of the virus being killed. However, what we do show is that a treated textile with Healthguard provides 24 hours, 7 days per week, vigilant guard against any coronavirus settling upon there. The astounding results which I have just revealed to you show that within 10 minutes, which means the Healthguard is beginning to work immediately upon the virus. Within 10 minutes, we have a 99.99% reduction in virus upon a treated textile. Now, our competitors who have heavy metals and various other methods of doing this are claiming 99.9% reduction completely.
Introduce Healthguard PF
products, the way in which products are formed, and we do it with purpose to preserve human life and help quality of life with good products which are there 24 hours a day, 7 days a week to help with human health. Thank you.
So why is Healthguard the choice? I mean, there's many products on the market that purport to provide certain efficacy. The long story short is Australia is well known for the premium quality products. We have a combined history of over 50 years experience in the textile industry. We were not developed overnight. We have a very rich history with textile knowledge. We understand the need for a safe, high quality and hassle-free applications, which have been enhanced in conjunction with the use of Britical silicons to achieve excellent wash durability at ultra low cost. On this slide is just a brief demonstration of the styling of hang tags that we present to you. We have a wide range of hang tags, and these are otherwise provided at a cost. Britical will provide for you at a cost when used in conjunction with certain Healthguard finishes. Certifications and compliance. So Healthguard treatments are compliant with current biocidal product regulations. The antimicrobial agents are well positioned in PT2, which means they are recognised not merely as a fabric preservative, but that of a health benefit to humans. Unlike a PT9 product, which is about the textile preservations, we all know that whilst you might get pinking on fabrics, a PT2 product allows for the person marketing to be able to explain the benefits of the human health benefit derived from using a treatment that is classed within a PT2. The PT18 is respective to the anti-dust mite and the anti-mosquito treatments. As you can read for yourself, and you may wish to go over later, we are currently undertaking the evaluation for the ZDHC level 1 and level 2, of which we've passed the pre-assessments. We are currently in the process of Okotex. Healthguard PLB, which was the anti-dust mite treatment, has already been approved by the Australian government. And is recognised and endorsed by the Sensitive Choice, which is the National Asthma Council of Australia. Overall, we class ourselves above the rest in regards to the treatments that we provide. We've been doing this for a very long time. We understand that the need for the textile mills to be able to apply this, what the consumers are looking for, and more than anything, we have over 25 years tried, tested with these products. So people coming onto the market who have been around, only recently, who have taken this as an opportunistic approach. Us at Healthguard, we have a lot of foresight as to the type of treatments that we want to provide for the health benefits of people, and a rich history in safety as well. On my screen is just a brief presentation of some of the brands that we're treating globally. This list is totally is 1/8 of the big brands that we're treating worldwide at the moment. We've got a very extensive list, and we're very well respected within the biotech industry. Thank you very much. We appreciate the time that you have committed to listening to our presentation. Thank you.
Thank you, Dr. Harvey. Thank you, Victoria. So before Q&A session, I would like to request Mr. Naisab Desai, Managing Director of Bitacell, to say a few words about today's event. As we know, we are very short of time. So, Mr. Desai.
Is it mute? Thank you. Good afternoon, and thank you, Vardhman and Healthguard, to provide Travel Shield the need of an hour. I must say it is a golden day for Vardhman and even for Healthguard, because the report which has been presented by Dr. Harvey is heard for the first time by Vardhman team as a textile mills, and first time by Bitacell also. Thank you all, and thank you for the nice time on the golden day. Now let me say a few words, as full properties has been already given by Dr. Harvey. We all know that for next 2-3 years we all will need more protection than wearing mask and hand gloves. Travel Shield offers the more non-toxic shield to the wearer and is with negligible pollution to the environment whilst processing, compared to the alternatives which are available in the market. Silver is uh, more toxic to the environment, more toxic to the human, and more toxic to the washer also for the daily use. There are other alternatives available in the market. I would like to thank Vardhman for selecting cosmetic based derivatives from Healthguard. Now, let me add that these other alternatives are sold at artificially very high price to encase the need of the textile mills as of today. It is an opportunistic approach, as Victoria Harvey has already told us. We came in, we were also representing a product based on silver from 2007 onwards till 2013. Then, due to the some toxic reports and all, we thought that we should have some change, and then it took 2-3 years for us to locate safe alternatives and the safe products for antibacterial. Nobody had the requirement of antiviral in those days. No doubt there were in 2003 when Healthguard AMIC was used, Ebola virus time. Healthguard AMIC was used in Africa, but this was an occasional use. It was not a worldwide effect. This is the first virus, corona COVID-19, which has a worldwide effect in all the countries. Nothing is left. Everybody is affected. I am very happy that Vardhman, being a big brand of India and the largest textile mill of India, has thought clearly and taken the cosmetic based chemistry. Now, when we came across Healthguard about 3 years back, to give a cost effective alternative, we thought of developing a product along with the Healthguard products to offer to the textile mills, so that the durability is achieved much more than what is needed, and it becomes more cost effective to the customers. So it took us a lot of time to develop a product which is with a long durability. And with one of the customer, who was looking for 50 wash and 100 wash in case of antibacterial, just with 5 GPL, we could give a wash durability of 150 washes, and with just 1% of the dosage, we could give a wash durability of 100 washes. And this is possible because the silicone we have modified in such a way, instead of choosing any binders, we have chose the silicones only, so that people don't use any other softener. They use only the softener which we recommend, which will have the epoxy cleavage on the fabric. So as soon as it comes in the contact with the process in the padding bath or in the exhaust bath, it immediately gets attracted to as silicone gets attracted to the fabrics first. It forms a cleavage net-like structure, and it allows the Healthguard to penetrate inside the core of the fiber, and that's how it becomes more durable. Instead of the alternatives which are available in the market, which chooses the binder system and adding the weight to the weight to the fabrics, then to compensate that weight, you have to add a lot of softeners with this. So I would like to just say that the products which we offer, silicones along with these products, are for more durability. It has got no other side effects, You can very well use it, and it is cost-effective products only we are giving as the choice, as the motto of Healthguard, to offer cost-effective and not to take any opportunistic approach. Thank you, Vardhman, and thank you all for joining in and giving time. Thank you.
Thank you, Mr. Desai.
Thank you, Ravi. Thank you.
Yeah, we will go ahead and we will take some time for questions now. I would request Mr. Sanjay Gupta to coordinate Q&A sessions. In case we left with any questions, we will answer through mail one-to-one. Mr. Sanjay Gupta, over to you.
Yeah. Dr. Harvey, there's a question from Healthguard is effective against is it effective against SARS-CoV-2? And if yes, whether it is tested from for which test and from where?
Yes, we have. I showed you during the presentation. We have our results right now here with me from Melbourne University, from the Doherty Institute and the Royal Melbourne Hospital. We are more than we're effective, not 99.9% effective. Their results show we have completely destroyed the virus. It cannot be detected, not detectable. Thank you. I think that answers your question. I hope it does.
Yeah,
anyway.
thank you. This is another question being raised from Neeraj Modi. Ravi, you have to answer that query. That we have launched this travel shield, okay, but can it be used for other applications? Like, can it be used for the doctors, for people going to the bank and malls? So, what is your opinion about it?
Sanjay, absolutely. This is a concept which we have launched through a travel shield. But whatever the finishes we are highlighting here, they would talk about stain repellent, breathability, water repellent, moisture resistant, odor resistant, and whatever the finishes which Dr. Harvey also highlighted. These all finishes are applicable for outerwear, for apparel, for trousers. So we can use. There is no issue in applying these finishes on other apparel segment. Thank you.
And one more question from Mr. Praveen Gupta regarding the tags. Will it be available with the finish fabric?
Yes, Arundam will be able to take care of that query. Arundam, could you please answer the question for Gupta?
Yeah, this is that like customers asking for the tags. So will it be the COVID-19 tags will be available with the finish? I think it's there in the presentation.
Yeah, it is in the presentation, Sanjay. Tags are available. We can provide tags. There is no issue. Already the picture of tag Dr. Harvey shown in their presentation also.
And one now other question I have got from Mr. Ash Sharma 9 is the ID. Is Healthguard products are registered with federal agencies to export fabric garment from India to European Union or US? So Mr. Dr. Harvey, it's for you.
Victoria is our registration expert. The EU is good. Let me just add. We are working with the US EPA and the FDA with the biomedical, also with the Biomedical Advanced Research and Development Authority, with the specific oversight of Alex Azar, the United States Secretary of Health and Human Services, who is actively moving through BARDA, the Biological Advanced Research and Development Authority, to have Healthguard hurried through both FDA and EPA registrations. That I can tell you. However, the EU is, you are EU BPR compliant with Healthguard.
Okay, thank you, Dr. Harvey. There's one question from our customer name ID Vinod. So, have you conducted taxological studies on your products, and are your products compatible with the screen chemistry regulations?
Well, let's put it this way: the active components and the inactive components in Healthguard Amick are both INCI registered, which means they are for use on in cosmetics, leave on your skin products. So we don't the toxicological data. Of course, we have done that. We know full well that we are literally days away from having our Okotex registration for Healthguard Amick approved. So yes, we have done our work.
Yeah, I think I have covered most of the questions. Mr. Ravi, I think many of the questions have been covered.
Absolutely. Yeah, I can see there are some few questions, but definitely we will answer all those questions through email or one-to-one we can reply.
Yeah.
So I think it is a great time, and thank you, Dr. Christopher and Miss Victoria, and thank you, Vitasil team. And great, thank you everyone. We appreciate being here. Thank again for joining us today, and we will see you next time.
Yeah, in fact, if you have,
yeah, please. Yeah, Sanjay, you want to add something?
in fact, you to all our customers, like who are the guests over here, if you have any query, I have given my mail ID and my mobile number. You have on the invitation as well. You can text me or call me anytime. I will answer your queries. I will, if required, I will get connect to Mr. Harvey also. I think it's sufficient.
Yeah, thank you everyone. We appreciate you being here. Bye bye.
Thank you.
Thank you. Thank you.
Thank you very much. Thank you for joining us.
Thank you. Thank you, Bansal sir. Thank you, Bansal sir.
Thank you, Ji. Thank you very much.
Thank you. Thank you.
Thank you, Ravi ji.